I'm Jerry Hesch, and I'm here at a clinic near Fort Lauderdale. It's in Coconut Creek, Florida. And we treated Tracy, and I so wish I had thought to film that because it was a very interesting case of right knee pain. I'm going to let her tell the story.
I've been a chronic subluxer with my patella since I was very young, and at the age of 14 I had a medial meniscectomy, and I've had chronic issues with my knees since this, which have progressively gotten worse with age. I got to the point where I couldn't sit and actively extend my knee without having extreme pain.
So could you demonstrate that? Just demonstrate the movement that hurt you.
So whenever I would sit and fully extend this knee,
yes,
which I couldn't, I would have pain even before I got to the end of the range, terminal extension. I've gotten to the point where I couldn't do anything open chain for quad strengthening. I couldn't
explain that. What is open chain?
I couldn't do anything
in which you're not weight bearing.
Which I'm not weight bearing, and then I couldn't do anything closed chain, like a wall slide, to the point, because I just had too much pain. I got to the point where I really weight shifted more onto my left leg. I was weight bearing more onto the left than the right. Just didn't use this leg because it felt unstable, the knee felt unstable, and I had pain. And then after...
Okay, so before that, there were no options for you to make that tighter?
There was nothing that I could do that would make that pain go away or that I could build up the quad strength.
And what happened when you would stand on that leg? Could you stand on the right leg then?
Well, no. Whenever I would single leg stance, typically, sometimes it would hyperextend and I would have pain. It just felt unstable. I just didn't do it.
So when I was screening you today, Sunday, I think the month is May, and somewhere around the 16th? Or
it's the 18th.
It's the 18th, oh good, okay. So I came and I pushed on just above your knee, I pushed on that very lightly, and what happened?
Oh, extreme pain.
Yeah.
Extreme pain.
So what did I discern with the evaluation?
What you discerned was that the fibula was
femur?
Excuse me, the femur, excuse me, was too, you said it was too hyperextended?
Yes, it was posterior.
So it was posterior.
And it felt lax. It felt like I could push it further that way. But you were very symptomatic. So then I put my hand under it, lifted with the smallest amount of force. What happened then?
And it was held for 5 minutes.
No. Oh. Before that, I just put my hand under and did a little tiny lift.
Oh, took the pain away.
Right. Immediately you said that feels
great.
better. So that told me to treat it. How did we treat it?
What you did is you placed a towel just above the knee, and then somebody else stabilized me at the tibia here, and then they put a slight pressure upward, and they held it for 5 minutes while I relaxed. And that was it. It was very gentle. So
what was the result of that treatment? Then I came back and retested it by springing it, and I sprung it 30 times.
You sprung it, no pain whatsoever. It was amazing. And now, as you can see, I can actively extend my knee. I haven't done that in 30 years, I bet. Okay.
And how do you feel when you're walking?
No pain. No pain.
How long have you had pain with walking?
I can't even, it's been so many years I don't even count. It's just always felt unstable. And like I said, I don't spend a lot of, I decrease my stance time on this leg when I walk. So now I can walk, it's pain-free. I can actively extend it. It's just such an incredible difference. I can stand on it, and it feels stable and safe, and it doesn't hurt. And I can balance on it, and I haven't done any of those motions in years. It was incredible.
I cannot anticipate that this would come back, but let's just suppose it did. Would you know how to treat it?
I'd get someone to do the same treatment that you did me.
Exactly.
Absolutely.
So what's your overall opinion about this field called manual therapy, in which we evaluate joints for small motions like the femur going posteriorly while the knee is extended, and testing that? What's your thoughts on manual therapy as a part of an examination of someone with knee pain?
Well, I'm a big believer in proponents of manual therapy.
In general?
In general.
Okay.
Yeah.
And I'm asking it specific to this treatment.
Well, again, you didn't do a manual therapy technique, I gather.
Well, the testing was, we did a
yeah.
spring test, okay,
Correct.
which told me that the knee was hypermobile and that the femur distally was hyperextended.
Right.
So then we did an anterior glide treatment.
Correct.
With our hands and a towel.
Right.
Okay.
It was miraculous. It was, I mean, like I said, the results speak for themselves. I just can't believe that I can do this. I can do all the things that I couldn't do.
How long do you think this knee has been hyperextended?
I don't even know. Like I said, I've had issues since I was a teenager, and they've progressively gotten worse over time.
When was it that you couldn't stand on that leg?
I really haven't single leg stance for 5, 6 years. I mean, I couldn't put a time frame on it. It's been years. It's been years.
What are you going to do with your new knee?
I'm going to go dancing. I don't know. But
what do you do for a living?
I'm a physical therapist also.
Good.
So,
What's your practice?
but I'm actually a neurotherapist. So
Okay.
what I do is I work mainly in stroke rehab with MS.
Okay.
You know, I'm going to continue to do things, and now I can build up my knee strength, which is incredible. I can actually do the exercises before that always hurt, and so it's going to be nice to build up this knee and get more strength, more function, more range, and it's going to help me in my practice too, because it's limited me for what I can do in my practice.
Sure. Well, I sincerely believe that testing end range joint play is a very important part of an orthopedic PT examination and treatment, and particularly in the post-op stage. So I so wish we had filmed it before, but you did a nice job of recapping the story. Thanks so much. I appreciate it.
You're welcome.